Hello and welcome to another lecture on veterinary anatomy brainry. And today we are going to discuss the gross anatomy of heart. So in front of me you can see one big heart and the one small heart. This is probably of horse and this is of leopard. And usually the heart is also known as core or the cardia, and the artificial heart is usually known as the abiyocore. And this heart usually lies in the middle of the mediastinum. Mediastinum, there is a division in the thoracic cavity. So this is the chest thoracic cavity, where there is a division of this thoracic cavity as anterior, middle, and the posterior mediastinum. And this heart lies usually on the middle mediastinum, and 60% of the heart is usually on the left side or in the thoracic cavity. And this heart basically is lined by outside by the pericardium. You can see here in the sorry sorry lined by this pericardium. And this pericardium basically is a fibrous sac that encloses this heart, and having the two layers. One you can see outer layer, this one. So this is the fibrous pericardium, and outer fibrous, and inner will be the vascular. And this fibrous pericardium in case of the animals has attachments with that of sternum, also with that of diaphragm also. So in the animals like cattle, horse, and pig, fowl, the apical fibrous pericardium usually here has the ligament that attaches it with that of the sternum, and forming the ligament that you call as sternopericardic ligaments. And in case of ruminants and in case of pigs, these sternopericardic ligaments are two in number, while in case of carnivore and in case of elephant, this apical ligament is not attached to the sternum. It is attached towards the diaphragm, while forming the forming the pericardiophrenik ligament, because it is attached towards the diaphragm. And inside, what I told you, that fibrous layer is the outer, inside there is a serous layer. So if you remove this layer, what you see here is the one of the serous layer, because serous layer itself is divided in two parts. One part or one layer will be attached to the inner surface of the fibrous layer, forming the parietal layer, and one part is attached towards the heart. So one part is attached towards the heart, forming the visceral layer. What you see here, the glistening surface or shining surface of the heart, is because of this heart is covered by the serous layer of the is covered by the serous pericardium, and that is the visceral layer. And when it covers the heart, that time it is known as the epicardium. So this is here is known as epicardium that covers. So this is the part of the serous pericardium. Heart has two sides. One of the side will be the right side, and one of the side will be the left side. The right side is usually the venous in nature, and the left side is usually the atrial in the nature. This heart is having the two surfaces. One of the surface what you see here is this one, that is the left surface. This one will be the right surface. So if you are putting the head this way, and if you're putting the tail of an animal on this way, so this becomes the right surface, this becomes the left surface. Then it has two borders. One of the border will be this border. So this is the cranial border, and this is the caudal border, and it is having this big area what you call as a base, that is mainly formed by this atria, right and left atria. Then it is having the apex, mainly formed by the left ventricle. Now the base, that is directed dorsally towards the upside, and usually formed by the atria, and apex is usually directed on the ventral aspect, and it will just touch the sternum, because it will be connected in some animals towards the sternum by the sternopericardic ligament. And if you draw the axis of this heart, so it should have been, heart should have been like this, but the axis of the heart is oblique, so heart is directed like this, with the result the just like this. So with the result, the this right side of the heart, so this is the right ventricle, and this here it is the right atrium. So it becomes cranial towards the head, and it becomes right. So right side, if you want to see the heart, it is more cranial and the right, while as the left side becomes caudal and towards the left, because of the oblique direction of the long axis of the heart. Then caudal border, what I told you, is nearly straight, you can see. So this is the caudal border. So this is the cranial border is almost convex. So the caudal border is towards the diaphragm. So this way, take my hand as a diaphragm, because after the diaphragm one more cavity will start, that is abdominal cavity. So the caudal border is in close contact with the diaphragm. And in case of the ruminants, in the abdominal organs, the most cranial part in the abdominal organs, in the ruminant stomach, is the reticulum. So this way, on thoracic cavity, this will be towards the diaphragm, and on the abdominal side it will be reticulum that will be touching the diaphragm. And sometimes there is an ingestion of the sharp objects in the ruminants, and that sharp object usually pass into the reticulum, then it will pass towards the diaphragm, then it will touch towards this ventricle, this border, what you call it as the caudal border, and it will just touch, and it will pierce into the ventricle here, what you call as TRP, traumatic reticulopericarditis, a condition usually you can see in case of the animals. So then, if you take the shape of the heart, usually in case the heart, if you see the shape of the heart in a general shape, it is usually irregular flattened cone, like so, cone shaped, flattened cone shaped structure. And if you compare the hearts of ox with that of horse, this is the heart of horse. And usually the heart of the length is more in case of ox as compared to that of horse. Then in case of the goat, usually if you see the goat heart, usually this is more pointed, this apex is more pointed in case of goats. And a prominent feature in case of ruminants is that if you see that the atria basically has two parts. One is this blind part, what you see here, here also, and this blind diverticulum is called as auricle, and there is a main cavity, what you call as sinus venorum. So sinus venorum plus auricle together is called as atrium. And in this blind diverticulum, in case of the ruminants, there is a particular feature. There is this border, this auricular border is usually serrated. It is serrated like a saw. So if I am drawing here the border of this auricle, so usually, so it is like this. So this auricular border in case of the ruminants is a saw shaped. That is a prominent feature in case of the ruminants. And if you look out the deposition of the fat in the heart, so the color varies in the different animals. So this is of horse, and usually the color is yellowish. In case of the ruminants, if you see the color of the fat, it is yellowish white. And in case of the heart, in case of the pig, usually the heart is short, and it is usually the apex in case of pig is blunt. And if you see the heart of elephant, usually the prominent feature in case of the heart of elephant is that this apex is usually double. There are two apices in case of the heart of the elephant. And in case of the fowl, usually the heart is very elongated, having three surfaces. Then if you look out the weight, the percentage contribution of this heart to the body weight, usually in case of ox, the percentage contribution is 0.4 to 0.5%. In case of horse, it is 0.7%. That means 0.7% of this heart will contribute to the body weight. And in case of the pig, the heart is very small. If you go for the comparative analysis between the animals, and it will contribute 0.3%. Because of this small heart in case of the pig, there is a one syndrome, what we call as a sudden death syndrome in case of the pigs, because of the small heart size. Then in case of the dog, the contribution is usually 1 to 2%. In case of the fowl, the contribution to the body weight by this heart is usually 0.5 to 1.5%. And when you see the position of the heart, in how it is positioned and what is the area where it is positioned, if you take the rib cage, this is the rib cage. And if you see the position of the heart in the different animals, and in case of ox, horse, pig, and dog, so if in case of ox, horse, pig, and dog, the heart lies between third and sixth rib. So if you count here the ribs, this is 1, 2, 3, 4, 5, 6. So the heart lies between, so third one is this, third, fourth, and fifth. So heart lies in this area. So third, fourth, fifth, and sixth area. So here so in this is the area where the heart lies in case of ox, horse, pig, and dog. In case of cat, it is fourth to seventh. So fourth means from this 4, 5, 6, 7. So this is the area 4 to 7 in case of cat. Sheep, goat, it is second. So it is second to fifth, second, third, fourth, fifth. So this is the area where the heart lies in case of sheep, goat. Elephant, it is first to fifth. So from here to here in case of elephant. And in case of fowl, usually there is no diaphragm in case of the birds. So the heart is usually in the thoracoabdominal cavity. Then if you see the division of the heart, I told you it has divided into the right side and the left side. And then this division is basically there is grooves that divide the heart into the venous side and the atrial side. If you look out these grooves, what you can see here, one of the groove you can see here, one of the groove is between the atrium and the ventricles, and one groove will be on this side. So if you take the first groove, that will separate the ventricles from the atrium. So this is the groove that surrounds the heart, that we call as a coronary groove. So this is the coronary groove, and this is also called as a transverse groove. This is also called as the atrioventricular groove, also called as a sulcus coronarius, and this indicates the division between the atria and the ventricles. So you can see this is completely encircles, it completely encircles the heart, except at this position where there is an origin, except at this position where there is an origin of the pulmonary artery. So you can see here, up to here it will come and it will discontinue here, because here is the origin of the pulmonary artery, then it will start again. So at the origin of the pulmonary artery it will discontinue, and then it will continue again. Then this groove will have nerves, vessels, it will have coronary arteries inside, and that will be shown in the coming lectures. Then there is a longitudinal groove. So longitudinal groove, also known as interventricular groove, they are two in number, one is left and one is right position. So this is the left and this one is the right one, and both grooves will originate from this area, coronary area, because it's a coronary groove. So you can see that this longitudinal groove is originating here, coronary area, and there is one more groove on this side. You can see this side here, it is also originating at the coronary groove area. So if you take the left, and this is called as a left anterior. So usually the left anterior is also known as a paraconal. It's also called as a paraconal interventricular sulcus. And how to determine that it is a left? Just see the pulmonary artery here. So this is the pulmonary artery. Just behind this pulmonary artery, this groove will start. So this is just starting behind the pulmonary artery, you can see. Then it goes down. So it will go down like this towards the posterior border. You can see here it is starting just behind the pulmonary artery, then goes down and goes towards the post, because this is the posterior border. Then if you see the right one, so this was the left one, so this is the right one, again starting from the coronary groove, and it will start just below the sinus. Sinus venorum is the main cavity. So this is the main cavity. This is the main cavity of this atrium. Just below this it will start, then goes up to the apex. So it goes up to the apex here. You can see here, goes up to the apex here. And this is the feature of the hearts that it will have. But in case of ruminants, there is one more additional groove. There is one more additional groove in case of the ruminants on the left atrium. So this is of horse. There are only three grooves. One is left longitudinal, right longitudinal, and the coronary. In case of the ruminants, coronary will be there, left longitudinal will be there, right longitudinal will be there. Then this is the left atrium. There will be one more groove like this, but it will not reach up to the apex. So coming lectures I will show you in some heart of ruminant where is that groove. So one of the groove will be here like this, and that is a special feature, that is a characteristic feature in case of ruminants, where there is a presence of the fourth groove, what you call as the intermediate groove. This is the heart of horse. There is no such groove, and by that groove you can differentiate the heart of ox and heart of horse by that what you call as the intermediate groove. And this is about the general morphology or the some gross anatomy of the heart. The interior, when you go to dissect, I will show you how to dissect this heart, what is the criteria to see the interior features, and what are the areas where you can go for the dissection. So this was about the outer anatomy of the heart. Thank you very much.